Thank you for coming to the part 2 of this video. I am Dr. Vibhor Borkar, Pediatric Gastroenterologist, Hepatologist and liver transplant physician practicing in Mumbai and Western India. In this part of the video, we are going to discuss the later part of the immediate post-op care. The ICU stay generally lasts for 3 to 5 days. Now what happens in these 3 to 5 days is most of the IV fluids are decreased, oral intake is improved. Also, the invasive catheters like Foley's catheter, blood pressure monitoring lines, central lines, they are gradually removed as per the child's response. Once all these invasive lines are removed, generally the child is fit to the shift to a ward where a special room is given in which there is again one-to-one sister is given and one of the parent can stay with the child so that the child is comfortable. Another important aspect of the management is physiotherapy, and it's very important and crucial aspect of the recovery phase. The physiotherapist is an integral part of the recovery team. The physiotherapist ensures that a chest physiotherapy and the limb physiotherapy is given so your child is fit to resume the normal activity once the child is discharged from the hospital. So regular chest physiotherapy is given, and once the child is stable, we gradually move the child out of the bed. So generally from day 2 or day 3, we make the child stand despite having the drains, and the general most of the kids do have a willpower to stand in this situation also. Generally by day 3, day 4, ambulation is done and we try to make them walk to certain meters. Once the child is shifted to the single room, this phase again lasts for generally 2 to 3 weeks. In this period, the nutrition is improved and optimized as per the child's requirement. Antibiotics are completed. Most of the time the regular blood levels are done. The immunosuppression medication like tacrolimus, it needs to be monitored as per the level, so that is routinely done and ensure that the liver function is recovering well. At the same time, one of the parent is with the child, so that continuous emotional support is very important. The planning of the discharge also starts during this phase. What is included in that phase is the caretaker of the child is made comfortable with the medications. There's a long list of medications, all new names which may be confusing depending on the language the family speaks and also the educational status. Most of the time looking with the list, you may get overwhelmed, but don't worry. To support this phase, our sisters are specially trained in that. So initial few days as the parent, you are observing how the medications are given and how frequency they are given. Before few days of a discharge, this medication are given by the parents. Parents are taught to read the name of the medication, strength of the medication, and depending on the need, they can modify it. So this much empowerment is given to the parents so that they are comfortable in taking the care of the child once they are at home. So this step is very important so that no mistakes are done with the medication. Right medication is given at the right time, at the right dose, so that liver recovery is not hampered. So parents, this was in short what happens in the immediate period, and you have learned how the doctors, sisters management is done and the parents are involved in the management to ensure the smooth transition. In my next video, we are going to discuss how to take care of the child after discharge. If you think the information is useful, please don't forget to like my video and please subscribe my channel. Thank you.